Now, tonight in medical rounds, if you suffer from sleep apnea and the C-PAP machine does not work for you, well, there's a new treatment that may help. Doctors at Hartford Hospital are using an implantable device to treat moderate to severe obstructive sleep apnea. And joining us tonight is Dr. Moeller. He is an ear, nose, and throat specialist at Hartford Hospital to explain more. Good evening, Dr. Moeller. Thanks for being with us tonight.
Hi, Denise. Thanks for having me.
Well, what is, first of all, obstructive sleep apnea?
Sure. So obstructive sleep apnea is essentially collapse of the soft tissue of the throat while the patient is sleeping. In the mild form, this can lead to snoring. When it's severe, we get complete collapse of the airway, which causes drops in oxygen levels. This can lead to significant daytime sleepiness during the day, and over the long term can lead to significant ill health effects, including high blood pressure, heart disease, cardiac arrest.
Wow, so this is truly a serious problem that should be addressed. And tell us now how the implantable device would help with this.
Yeah, absolutely. So typically, sleep apnea is treated with C-PAP, which is essentially a mask that blows air into your mouth and nose. Now, C-PAP works very well, but about 50% of people really don't do very well with C-PAP. And that's when we start thinking about surgical options. At Hartford Hospital, we've been implanting a device called Inspire, which is a hypoglossal nerve stimulator. We just recently implanted our 50th patient. Essentially, this is like a pacemaker for sleep apnea. It senses when you're taking a breath, sends a gentle stimulation to the tongue, and prevents the throat from collapsing during sleep.
Doctor, we have a few seconds left, but I want to ask you, who would be an ideal candidate for this device?
Sure. So patients who do not tolerate C-PAP, patients with moderate to severe sleep apnea, and patients who aren't excessively overweight.
Good to know. All right, we thank you so much, Dr. Moeller. It sounds hopeful for many patients. And if you out there, if that's you, if that's your condition that you're suffering from, you want to learn more about the procedure, just call the number you see on the screen.
Well, if you're